really can honestly say, not to be cliche, I've always wanted to be a nurse.
Since I was like 5 years old, I wanted to be a nurse.
I always wanted to help people.
I want to care for people.
I just kind of wanted to do something like that every day that I could share that happiness.
I actually wanted to be a doctor first.
My dad doesn't want to pay for my med school anymore, so I became a nurse.
My parents basically said, this is what you're doing. They saw something in me that I didn't.
Everyone has their story.
I suffered with asthma as a child.
When I was about 12, I actually had to get my appendix out.
My father was sick.
I ended up being the one to take him to all his chemo.
I know how it feels to be on the other side.
I had an epidural, had a Foley, had a chest tube, just not where every 16-year-old girl wants to be. But I had a pretty awesome nurse.
I saw how the nurses took care of my dad.
If I was ever in the hospital or ever had any surgery, it was always the nurse that you remembered.
I feel like everyone knows a nurse.
My mother's a nurse.
My mom, my older sister.
My neighbor at the time.
My father was a medic in the Air Force.
I shadowed a nurse one day, and after about an hour, I thought, this is what I want to do. And I immediately applied to school.
I went to work as a nurse's aide, and I absolutely loved it.
Met my first patient and their family. I said, yep, I'm hooked.
I sort of never looked back.
I started as a staff nurse. You can be a school nurse, you can work in a hospital, you can work in the operating room. I chose to work at the bedside.
The best field to always have an opportunity to care for people, it's nursing.
I feel that I'm fulfilling that every day. Just making a difference, even just a little bit.
This is a lifetime calling.